Hi, this is Marty. Welcome back for another video. All right, so in this video, I'm going to talk about the onion skin method of a skin classification from a professional point of view, from a registered nurse, a doctor, or an esthetician. Okay, but I put this on my personal page as well, video, because what this can also help you as a purchaser or buyer of skincare products if you do this with yourself. Okay, there's absolutely. But just remember that skin experience and the ability to change a person's skin comes with experience across all skin types. So you as an individual can learn this information, but you will never reach the level of a professional esthetician or registered nurse or doctor, dermatologist. It's just impossible. And basically the reason why is because of the level of experience that comes from dealing with all different types of skin types. Okay. All right, so onion skin. Okay, so the first one, I'm going to go through all five. Okay, so first, an onion skin is basically this. See, this is, you know, 1 layer, 2 layer, 3 layer, 4 layer, 5 layer. Each layer represents 1, 2, 3, 4, 5. Okay. So the first thing you want to do is decide what Fitzpatrick scale she is. And how you do that is think of this. And I've done it before, but it's 1, 2, 3, 4, 5, 6, 1, 2, 3 on the small scale. So I came up with an idea to make it easier for skincare professionals to remember the Fitzpatrick scale and how to classify their clients. So 1, 2 and 3 on the small scale resembles 1, 2, 3, 4, 5, 6. All right. So number 1 and 2 is on the far end of the scale, and think of albino. 5 and 6, 6 being on the right hand of the scale, think of absolutely black skin. Okay, and as you come from the far left and the far right, everything in between, I guess you get someone like me. Okay, all right. So what we're going to look for on Fitzpatrick scale, it's very, very simple, is eye color, hair color, skin color, and lastly, what happens to them when they're in the sun. So blue eyes, green eyes, blonde hair, lobster red, bright white is a 1, right? And a 6 is black eyes, black skin, black hair. I can't see the burn, but this does burn. It does. Okay, so don't think that it doesn't. It does. But with that being said, that is the far left and the far right extremes as it relates to Fitzpatrick scale 1 through 6 or 1 and 3 on the small scale. All right, so once you've determined that, you come to number 2, the type, dry, oily, normal combination. All right, so I have a rule of thumb here. Dry, oily, normal, and combo. Which ones should I not pay attention to? Or what do they all mean? Okay, so dry skin, look at weather, obviously look at weather, okay? And look at what they do with products, meaning overuse of this, maybe they don't ever put moisturizers on, maybe they never drink water, look at dietary concerns and things like that, and you can get that here in the client interview and the client goals and discussions. Okay, so oily, if someone says I'm normal but oily and they tend to go combo, immediately you go oily. Okay, the minute someone says oily, think of, in the Serene line with cleansers, salicylic acid. Immediately. Dry skin, think of no acid facial cleanser sensitive skin. All right. When they say normal, do whatever you want to do. Okay, occasional menstrual breakouts, things like that, go directly with facial cleanser sensitive skin on the Serene line and or AHA3 facial cleanser. I ignore combo altogether. If you tell me combo, that's not a choice. What is combo? How do you deal with combination skin? It's a nightmare. So you need to train and or influence and or guide the client into something you can deal with. I'm oily here. Well, so am I. I'm oily here, but nowhere here. I'm not combo. I'm normal. I'm sorry, I'm normal. One and done. But I'm not going to say I'm oily here and therefore I'm oily. But if that's what I see in the mirror and I say oily and later on you're like, nah, because you always keep combo in your repertoire of descriptions, they're kind of combo. But they said oily. That is their perception. And taken to the next step, client interview. You're going to figure out in the client interview what they really think. And what I just said is going to come out in the client interview. So with that said, number 3, part of the onion skin method of skin classification is client interview. Find out everything you can about who and what they are. The less talking you do, the more you will learn. Let them just ramble. Interject when you want to guide the ramble, all right? So you as the interviewer, let them ramble on, and then you ask a question to divert them back to where you want them to go in the information you're looking for, okay? All right, okay, so pictures. The pictures are face on, left, right, and any close-ups you want, but you must take a minimum of 3, okay? All right, the more you take, the better, okay? Close up, far away, everything. Different lighting, outside, inside, all of that is gonna play an important role later as you take the client through protocols and or offer them skincare solutions through Skincare Science and Serene, or any skincare line, because this can be applied to any skincare line, okay, and very effective. All right, client goals and discussion. All right, this is where you sit in front of the client and you put a mirror in front of them and you say, tell me everything you hate about your skin. Write it all down. Tell me everything you love about your skin. Write it all down. Tell me everything you want to see different about your skin, and write it all down. Okay. Now, there's something else I go over. It's on the website skincarescience.com, and it's a sheet of paper with the face on it that basically says this, and you can download it. All right. So go to Skincare Science and go to Documents, log in, create an account, and you'll be able to get this document. All right. Basically, what it is, it's the picture of this face, right? And then what you do is you use triangles and squares and circles to represent different skin issues. You have to decide what each one of those means. And I think I actually put it on there, but it's been a long time since I've looked at it. And maybe this is acne, maybe this is hyperpigmentation, and maybe this is, I don't know, maybe a mole or something like that, okay? So you decide what you want these to describe, okay? But you must have something that says what different types of skin conditions and or appearances you're seeing with different description graphics, okay, so to speak. All right. Once you get all of this done, you will have a solid foundation of what this client is starting with and what their goals are. Now, I recommend that you have a file on your computer and a laptop and an Excel document or a Word document with all of this already done, and you type in it. Okay, because the pictures you download from your computer directly, or you can take them directly from your laptop. You see how that works? So there's no paper trail, there's no nothing, and if you can answer the client via phone call or texting, pull the client up, look at pictures, and you can take a picture from them. They can send it to you, via text, and you can put it inside. You see where this is going? It's developing a solid foundation of client control, client connection. You see how that works? All right. So this is basically a very solid and brief overview of the onion skin method of skin classification. I've never seen this anywhere else. This is not something that's earth-shattering within skincare, but it's a very precise and very easy way for professionals and non-professionals to get a very nice starting point, understand who they are, understand their goals, and then wait for it. Find tools, the active ingredients to solve and conquer client goals. This is Marty, and we'll see you in the next video.